Lovely. Well, thank you so much, everybody, for joining us for today's session on breast cancer awareness. So really, really important topics. It's great to have so many experts and people working in the field on the call today. So my name is Marie. I'm the health officer from Irish in Britain. Most of the people on here today I haven't met before, so it's lovely to meet you all. And today's session, we've scheduled 45 minutes in duration, and that's including Q&A. So we'd love to make it as conversational as possible. So it'd be great if you can, like you are doing now, have your cameras on, brilliant. But of course, it is a sensitive subject, so if you prefer to turn it off at any stage, please do feel free as well. As we go through the session, if you'd like to ask questions, you can raise your hand, you can type in the chat box, or please feel free to unmute yourself, get involved. Really would be great to hear your thoughts and suggestions as we're going through the session as well. So I'm joined today by some brilliant people who've taken the time out to come on and do this session with us. We've got Fiona and Mary from Irish in Britain, and we've got Lee and Renata from Macmillan Cancer Support. So I'll let everyone introduce themselves and then we'll get back and kind of start in with the session. So Lee, I'll start with you. I'll go by my screen.
Hi, good morning, everyone. My name is Lee Townsend, and I'm a community engagement lead for Macmillan Cancer Support. So my role simply includes or involves engaging with people across the length and breadth of North East and North Central London, ensuring that they're aware of Macmillan services, that they're aware of how they can get support around their cancer, and to help persons with a cancer experience to feed into the development of our services that we have across London and elsewhere, and also to give their feedback as to how we should develop these services to better support people living with cancer, or what needs to be fixed so that we can adjust services so that they can be more fit for purpose and better serving the community. So that's me. Thanks for your time.
Brilliant, Lee. Thanks so much for that. And Fiona, you're up next.
Hi, everyone. I'm Fiona from Irish in Britain, and I am a breast cancer survivor. So this topic is really, really important for me, and I'm so glad that we've been able to do this. So I'm going to be coming from it as the survivor side of it, and how I felt during treatment, and the fantastic work that Macmillan and the cancer nurse specialists do. That's me.
Thanks, Fiona. I think it's brilliant, and thank you so much for coming on to share your lived experience with it. It just makes it, all that more kind of real for people and engaging. So thank you. And Mary.
Hi, everybody. I'm Mary Tilke. I'm a retired nurse lecturer, and I have done a lot of research on health inequalities in Black minority ethnic groups, particularly the Irish, and in recent years have been working with Irish in Britain, looking at the way in which Irish people have disproportionate level of health inequality right across the range.
Thanks, Mary. And last up, we've got Renata.
Unmute. Hello everyone, my name is Renata. I'm the breast cancer nurse specialist in the NHS hospital in North London. So I meet patients when they are given diagnosis that they have breast cancer, and I support them throughout the treatments and for the next 5-10 years, however long they are followed up.
Amazing. Thanks so much for that, Renata, and thanks everybody for introducing yourselves. We've got a couple of more people joining now as well, which is brilliant. So I suppose we can get started.
Sylvia.
Yeah, and Sylvia, sorry.
Hi, I'm Sylvia. I'm the healthcare assistant for breast cancer at the Whittington, and I work with Renata and the rest of the CNS team. I'm quite new to the role. I'm in my 5th week, so we're still kind of working it out, but I'm happy to be here to learn and hear people's experiences.
Oh, lovely. Thanks,
so
Sylvia. Congrats on the new role as well. Welcome, Clodagh. Hello. So we'll get started, I suppose. And I suppose that one of the best places to start is thinking maybe about the impact of the pandemic. And we know breast cancer is one of the most common cancers in the UK. And I suppose like any cancer or any kind of illness, early diagnosis is really important, and early intervention. But I'm sure this, the pandemic, a lot of things maybe have been put on hold. People maybe have been a bit more reluctant to get checked, go for screening, this kind of thing. So from, any of our panel today, any thoughts in terms of, maybe Renata, yourself, in terms of people, the importance of getting early intervention and a diagnosis, or Sylvia even, how important is that for breast cancer? You can unmute again, Sylvia, or sorry, Renata.
I'm sorry, I think I'll leave it unmute
Yeah.
then. So research shows, very recent research from Breast Cancer Now, that during the pandemic, the screening program was paused at the first phase from March and just restarted screening program in mid-June, end of June. And that has affected the numbers of patients diagnosed and or being presenting with the more advanced disease. There were delays in appointments. People were not seen face to face. There were restrictions for patients to bring a close one to a very difficult emotional appointments. So the effect on patients going through the diagnosis and waiting for results must have been enormous, much more than how it used to be before COVID pandemic. There was less face-to-face visits. There were breast cancer nurses, all CNS team, clinical nurse specialists have been redeployed to work in ITU, to work in other inpatient wards, to cope with the pandemic at that time. So there was less support, psychological support for patients who were diagnosed during that period. In the trust, and most NHS trusts, we were still continuing seeing patients referred by GP, referred from accident and emergency when people presented, and we were seeing them, although the clinics have been decreased, so halved. There was less people around the hospital. And also to reassure, if it ever happens again, we were still treating people with the cancer diagnosis. So just because the COVID pandemic hit, we were not refusing the treatment for patients with breast cancer. So they were having surgeries, they were having chemotherapies and other treatments. Arrangements were made so people were safe coming to hospitals and having a safe treatment and life-prolonging treatment. We didn't want them to delay the diagnosis and treatment and present with much more advanced disease.
Yeah, Renata, thank you. That sounds, quite difficult for everybody involved. Yes, and yeah, hats off to people who, working in the service during that time. Very, very challenging from everybody's point of view. I see, Lee, you've got your hand up there.
Yeah, so generally we saw a lot of redeployment of our staff through Macmillan. So a lot of our Macmillan nurses that were people with a nursing background that were doing other jobs within Macmillan, they were then redeployed into the NHS services so they could assist with the COVID pandemic response. But in addition to that, we looked at strategies that we could employ in order to support people who had a recent diagnosis or were going through their cancer treatment. And in some cases that was stopped, paused or delayed. So in some of the trusts, what we had were every single patient who was who was under a cancer nurse specialist or under a treatment plan, etc., they were contacted and checked in upon, maybe over a fortnightly basis or something like that, to see how they're getting on, were they able to get their groceries and food, was there any support that they required. Macmillan also started a buddying service. So we had people who spoke different languages who volunteered, hundreds of people volunteered, and they literally were assigned to someone who was living with cancer, who they could speak on a daily basis or on a ad hoc basis that they'd agree to the times when they would speak. And that was just looking at the mental support needs that people had, that isolation that people would have felt. And these were things that we know can exacerbate your physical health condition. The mental health is not in the right place. It can cause that deterioration to take place. And in addition to that, our support line was running right the way through, and we provided a number of documents, allowed people to know their rights and what was available to them and what they could access during the COVID pandemic, and also the implications of that with their treatment plan. So even things such as the although that's later down, the oh gosh, I'm forgetting the injection. I'm forgetting what we call it. Sorry, I've just gone blank.
The vaccine?
The vaccine.
Yeah.
And explaining to people.
How could you forget that word, Lee? It's ingrained
every day. Explain to people the implications of having a vaccine and reassuring them that if you're going through chemo, if you're receiving treatment, that it wouldn't be a problem under X, Y, and Z a circumstance. Yeah. Those things were put in place as well.
Brilliant. Thanks for that, Lee. And I know the work Macmillan does is fantastic. And a lot of our member organisations do kind of partner up and hook up with Macmillan as well to promote services. I suppose in terms of getting a diagnosis, maybe Fiona, from your point of view, you know, Renata, you mentioned it was, you know, probably quite different pre, post, during pandemic. Did you wanted to share anything from your point of view, Fiona, about your diagnosis journey?
Yeah, well, it seems like a lifetime ago now, but yeah, I mean, for me, I was very lucky because I had a really good GP. So when I mean, I had a cyst earlier on in the year, and I went to the doctor about that. So when the lump came back, I wasn't overly worried because the hospital, when I had the cyst drains and everything, so it wasn't, you know, they just said, you know, you're lumpy breasts and things like that. So I wasn't overly concerned, but I think the fact that it just didn't move and it was sort of getting a bit bigger, and I kind of thought, oh, you know, this is not, you know, this isn't right. So that was in the January, and this is sort of coming up to sort of May, June time. And then I thought, no, I'm going to pop to the doctor and just get someone else to look at it for me. And my GP was great, and you know, he just said, yeah, no, this doesn't feel right. I'll send the referral. And yeah, I was seen within 3 weeks. But I remember when I went on that day, it was the 31st of July 2018, went up for the mammogram, and actually ended up not having, I had a mammogram and a radiologist scan and then a biopsy, literally all within 2 hours. And I met Renata and Miss Barber, who was my consultant, and I knew as soon as I walked into the room that it was not okay. She was lovely about it, so was Renata, but yeah, but I had to wait officially another week before they could confirm, because obviously they had to get the results back from the biopsy. But yeah, I just I was very, very lucky, because if I had left it, I would be in a completely, well, I might not be here, to be fair. So, you know, I was exceptionally lucky, and the hospital were absolutely fantastic. I was really, really lucky. But it's just the most traumatic thing. You know, you just, it's really hard to explain it. But once you get the diagnosis, then you kind of, it's like a roller coaster after that. But it's getting that diagnosis, and you know, and it's not. It's having the confidence to just speak to your GP and just say, look, this is really worrying me. It doesn't feel right. We all know our own bodies. We do. So we know when something's not right. And, you know, don't feel scared to go to the doctor. You know, that's what they're there for.
Thank you so much for sharing that, Fiona, and being so open and honest about your own journey. Thank you. But I guess, you know, like a lot of communities, sometimes people can be reluctant to go forward and seek that help. And we know in the Irish community, Mary, you've done a lot of work on this as well, raising awareness and trying to engage the community more. Have you any thoughts on that in terms of maybe the Irish community in Britain and these kind of, you know, seeking help with the GP, this kind of thing?
Yeah, I suppose from a starting point, we're an older population. We've got a higher age profile than even the majority British community because of migration. So that itself is a higher risk factor for cancer. And we've got higher levels of breast cancer and lung cancer in women in particular not coming down at the same rate as it is in other groups. And some of the reasons for that is that we have got some risk factors there, such as smoking, which is reducing, but not quickly enough. We've got problems around obesity. We've got lifestyle and socioeconomic problems, although many of us have done very well and are economically well off. A lot of people are not in that economic bracket. But I think coming back to the presentation, being an older population, but not exclusively so, I think late presentation is a real issue. Many of the older people will sense that there's something wrong and maybe think, oh, it's not bad enough, I don't want to bother the doctor with it. So they won't go until it's late. I mean, breasts and cervix and things like that are also a bit taboo in an older religious community. So that may delay the uptake of either screening or actually going to the GP with the problem. There are issues around, in some parts of the community, people will, if they've got a problem with their health, they will pray about it and they'll have a particular saint or a particular range of prayers that they say, rather than going to the community, to the doctor. Now, you know, I'm not against the importance of prayer because it's a great support for many people, but if it delays getting a diagnosis, it's a problem. And then people are often embarrassed if they're smokers, if they drink alcohol, if they don't eat the right kind of diet. They're kind of anxious that the doctor is going to tell them off or give them a hard time about it. And I think another thing that's really important in the older Irish community in particular is this fear of cancer. Yeah. Many of them will have seen members of the family who presented late with a particular type of cancer and died a few weeks later, and maybe died in very painful or uncomfortable circumstances. So, you know, they're in denial about it. So there's a lot of work to be done in terms of health promotion around the community. And I think the other thing, we haven't got the up-to-date evidence, and I don't know if Renata or Lee actually have the evidence. There is some evidence as well that people are not referred on for treatment in the way that Fiona was. The referral on to breast cancer services or whatever is often delayed. So there are a number of different reasons that we've got to tackle there within the community with the help of organisations like Macmillan and, you know, professionals like Renata and the others.
Thanks for that, Mary. And yeah, I'm sure, you know, the Irish community, we've got our own kind of unique, perhaps, barriers there as well, but often these transfer across to maybe other minority groups as well. But you mentioned a few risk factors maybe for breast cancer. Now, there you know, like lifestyle perhaps, but I think there are a lot of maybe myths out there as well. And I don't know, Renata, have you any thoughts on, or could you share maybe some of the main risk factors for breast cancer, or are there any myths? You know, we hear things like deodorant and antiperspirant and not to wear these kinds of things. So if you have any thoughts on that, it would be very interesting.
Thank you, Mary. I agree with what you said. I would like to also add there is a lot of people that cannot read or write, and receiving letters for screening mammograms, or they cannot read that. They don't have family around, especially elderly women. So a lot of the diagnostic and preventative or early detection of breast cancers are missed because women don't present just because they couldn't read the letter. Also, you know, older generation, they are not so savvy with IT. So contacting GPs or going to GPs or even Googling something, checking on internet. So that's the problem. And I think more promotion and health promotion in communities, and especially directed to Irish community, would be good, you know, in the community centers, and doing some maybe self-examining teaching, so educating patients and reassurance that everything can be treated and they can be diagnosed and come to us and be treated. The risk factors with breast cancer for women, it's basically we're women, we have ovaries, and that's the biggest risk in the breast cancer. Then our age, when we age, that risk increases. Also the environment and our lifestyle as well is additional risk factor to get breast cancer. So like smoking, alcohol, unhealthy diet, obesity. I think a lot of, now these days, the pollution, the radiation from lots of flying, lots of technology around us, microwaves. So this is all additional factors that come to for people to get cancers. People with that's been diagnosed with cancers before, they are at higher risk to getting a second run cancer. Or they've had treatments for other type of cancers when they were children or when they were young. So that increases the risk of getting a secondary cancer, second primary new cancer.
Thanks,
I
Renata.
think that's mostly it. Yes, but
So a lot of, there are definitely risk factors there, but probably the main thing that's coming up here is this idea of all of the barriers that can stop people from seeking early intervention. So we might come back to that towards the end in terms of our key takeaways and maybe what we can do as individuals and maybe community organizations there. Once somebody does, like say Fiona shared a little bit about her journey, once somebody does receive a diagnosis, and Fiona said it is, your kind of world changes, it's a very emotionally kind of challenging thing to happen. What kind of support is out there? Ali, you touched on some of it at the start as well, maybe in terms of NHS, Macmillan, what's that kind of journey or pathway like for people, or how can we help signpost?
I think at the point of diagnosis for most people, they'll do what is called a holistic needs assessment. And that's basically, it's a questionnaire to some extent, and it asks various questions about where the person is at that point in terms of where their point of needs are. So for example, are they needing support with housing? It takes on all kinds of things, their well-being, the finances, etc. And that allows their nurse practitioner or GP, whoever it may be, to actually signpost them to services that can support them in the area where they have the needs at that specific point. And that's something that will take place at different points within their cancer journey. But in addition to that, we've got our Macmillan Information Centres, which is very much well known in the various hospitals where they're located. And people always see the Macmillan sign and think, okay, that's somewhere I definitely can go and receive some support. So the Macmillan Information Managers that man these centres, along with volunteers, etc., will always have different kinds of information that will meet the needs or the gaps that exist for the person who is going through that cancer journey and really just want some direction, some support, or sometimes a listening ear. In addition to that, we've got our support line services, and the support line services offer various kinds of support to people who are going through a cancer journey that relate from emotional and practical support. So there's even an opportunity to receive some level of counselling if it's necessary for a certain number of period of time or sessions. There's clinical information, so there's loads of clinical information that people can access. There's people that they can speak to directly on our support line to get that kind of advice. Financial support, as we know that we're talking about marginalised groups and the inequalities that exist, and that's something that Macmillan really wants to address, healthcare inequality. So ensuring that financial support is there, information where people can access grants, there could be rebates that people are entitled to, or even it could be a thing where they're entitled to things like disability living allowance and that kind of thing. So we'd ensure that that information is shared, but also where necessary, there's support to help with the filling out of these forms and that kind of a thing where possible as well. And work guidance. There are a lot of people who are living with cancer and hiding it or pretending as if they're a lot better than they actually are, just because they want to protect their job and feel that job security is so important and they don't want their employees to treat them any different. And the only way that we can get around these things is by educating people and supporting them to ensure that they'll be given the support that they're entitled to under the law and that they're required to receive. And then one of the great things about our support line services that we offer is that there's also the opportunity to call in and request to speak to somebody that speaks the language that you speak. So if English is not your native tongue, then there's other opportunities to speak with people who speak with different languages. And then there's a whole gamut of other services that exist. There's a lot of variety in terms of services. We work in partnership with other charities, with other organizations, and that is things that we're happy to direct people to and signpost to as is necessary, because it's not about being supported by Macmillan, it's being supported by the organization that will best help you. And sometimes that's one of our partners and not necessarily us.
I think that's a really good point, Lee. And Mary, I don't know if you want to come in here about the kind of importance of cultural sensitivity and accessing this support that's out there as well. So it might be similar to the barriers to getting a diagnosis, but it's definitely a key part in that support.
I think you're right. There is a need for cultural sensitivity, although not everybody who is Irish will want an Irish practitioner or an Irish volunteer or an Irish befriender, but certainly the older generation will. And I think the other thing that's important is we're not a homogeneous group. Not all Irish people are the same. We're very diverse. We're, different age groups, different parts of Ireland, different faiths and no faiths at all. And I think the other group that we really have to be mindful of is the Irish traveller community, who have disproportionately poor health right the way across the range of health issues. But I think for most people, particularly for the older generation, they would appreciate being able to talk to somebody who is Irish, or somebody who understands your accent, somebody who understands can pronounce your name if you've got an Irish name that doesn't read the way, like Clodagh's name, for example. It's also somebody who might understand the particular fears you've got and be able to put them in perspective. And I think the other thing about it is, if there are people who are strong believers in a particular faith group, having somebody who respects that, not necessarily goes along with it, but actually respects it and understands where you're coming from, will be very important, will be really important to Irish people. So I think, we're not all the same, but we are different. It's often assumed because we're white and the majority of us speak English, that we're the same as the UK, the British, the English community, but there are many differences there. Sometimes even with older people, the words we use, we've got different names for different things. And there will be a few Irish people whose first language, whose mother tongue is Irish, and they may want to speak in that language. So there are lots of issues that will favour working with an Irish practitioner or an Irish befriender or somebody who understands them.
Thanks, Mary. And I suppose, Fiona, just thinking about what Lee mentioned there in terms of kind of the support you receive. I know you're a member of a group like I think Youth is as well, Chatterbox. I don't know if you wanted to share any, or Youth, you want to come in as well, maybe share some of the things that you both have found really helpful and supportive in your journey living with breast cancer.
Yeah, I'm Diana's one as well, and Diana and I actually had our treatment together, so we met in the chemo ward. And Youth, it's from Chatterbox, which is it's a community, it's a cancer patient group basically, and we're all either going through it or have been through it or living with it, or and we get together once every 2 weeks and we just talk. But we designed a leaflet because my emails are popping in. But one of the things that we wanted to do was design a leaflet, because the diagnosis is probably the hardest bit of everything, because nothing goes in, it just flies over your head and you just don't know where to go or what to do. So we wanted to come up with some emotional and practical tips that we all kind of went through, to share with other newly diagnosed patients. I mean, I'll be honest, the chatterbox thing came about sort of the latter part, because you're so busy focusing on your treatment and your hospital appointments and your scans and your acupuncture and your massages and all the things that you need to go through to make yourself feel better. But I didn't really want to talk about it for a while. But I didn't really want to talk about it because I was exhausted explaining it to people, that just literally all they wanted to know about was my treatment. I suddenly wasn't me anymore. And then, we sort of levitated towards this group through Kirsten, who was amazing. We met her on the chemo ward as well. And, we all felt the same way. We were all exhausted trying to explain, how we were feeling and, suddenly not being us anymore and, other things that we just didn't know. And I had an absolutely awful time with my boss. So Lee, thanks for bringing up that you have that support, because my previous employer were absolutely awful and it added to my stress. And I didn't know where to go. And I ended up leaving because I just could not work there anymore, because at the time of my diagnosis they were fine, but when your chemo's finished, everyone thinks you're fine. But I had to go back to work financially because I had rent to pay and my bills to pay, and I still needed, and it just became a disaster. And I, if it wasn't for Chatterbox and for Macmillan and for the people that I was speaking to, I don't know how I would have got through that, because I was fighting them as well as fighting for my life. And you just kind of think, well, this is a bit strange. Well, why do people think that cancer is just, I found it really, really hard.
Thanks for sharing that, Fiona. Diana and you should thank you for joining as well. And if you want to come in at any stage or share any of your thoughts on anything, please do feel free. Love to hear from you. So I suppose one of the kind of the positive things we can think about now is this increase in survival rates for breast cancer. Renata, did you want to maybe come in on that and the importance of maybe early diagnosis, what the survival rates are, and any thoughts on that? Unmute again.
I think it's very important to get early diagnosis as soon as possible, especially what shows during the COVID epidemic. There is about 1.5 million women that's been delayed with screening and diagnosis of cancer in the UK.
And Renata, sorry, can I just ask you there before you carry on? It might be worth mentioning, just for some of us on the call as well, what would be the real early signs and signals to look out for with people as well? Actually, we have a video link that we'll be sending to everybody after the call, but it just might be useful to hear kind of what we would look out for.
So, I think Fiona said, we all know our body, and it would be good to look in the mirror every day and check our breasts, what they look like as normal breasts. There are different breasts, the different sizes and different shapes. But knowing our breasts, we can pick up the abnormalities that can show all of a sudden. Examining the breasts at least once a month. So the most common sign or symptom of breast cancer is a lump you find in the breast. It could be dimpling, or inverted nipple. It could be thickening of the skin, changes in the color of the skin, discharge from the nipple, sometimes pain and tingling. Also, sometimes the thickening of the skin, and it can look like an orange skin where the hair follicles are almost like inverting. So it's quite different. Itchiness that doesn't go away. Unusual, that may not be related to a new toiletries or new washing powders. Rash or bleeding from the nipples. I think those are most common symptoms and things that feel unusual. If you know your body, feel unusual and they don't go away. So it would be the first thing to do would be to contact your GP when you said there is some in the breast, lump or something unusual, they would see you very quickly, normally. And then once the referral comes through to the hospitals, we're obliged to see you within 2 weeks to make diagnosis, to do extra tests and scans, to make the diagnosis, and then start treatment within 60 days from the referral. So it happens pretty quickly, and it's very stressful. Like Fiona said, the first few weeks is tough and stressful, waiting for additional tests, waiting for results. So we do understand that, and it's very emotional. You don't think of other things. I don't know what, I'm not sure what else to remind.
I think I can come in there a little bit. Yeah, I mean, it's so hard to say, you know, what the signs are, because I just think that if something just doesn't feel right, regardless, just get checked, because you know a GP is not going to be angry at you for just asking a question that something just doesn't look right or sit right or feel right, you know. I mean, you know, I've always got it hanging over my head, you know, because my boobs don't feel the same at all anymore. So, you know, I'm due for my mammogram, which is great, but you know, but I'm still worried. You know, I don't know, it could have come back. So, you know, but at the same time, I'm surrounded by the best people that I know. So Renata, there's Lee, you know, there was my consultant, you know, so there are people that you can talk to if you can get hold of them. it's just obviously the pandemic has, you know, changed a lot of things, but just persevere, because, you know, you are entitled to get yourself checked.
Thanks, Fiona.
I think, sorry, can I think it's a very important early diagnosis, because we know there's about 56,000 women diagnosed, breast cancer diagnosis, and in that there's about 400 men. So it's not only affecting women, but also men. And there's about 400 diagnosed men in the UK. And the treatments now, early diagnosis helps us to treat it with better effects, prolong people's lives and quality of lives as well. So in 2030 or 35, there is a Macmillan estimation that there will be 4 million people surviving cancer diagnosis. The cancer diagnosis statistic, they increased. There may be 1 in 2 of us diagnosed with some kind of cancer in our lifetime. And having the improvements in technologies and diagnostics and the system in the NHS and private, that can help for us to survive and live full life beyond the cancer.
Well, thank you for that, Renata. And I suppose that's a really nice kind of way to maybe round up the session, to think that there is a lot of hope for diagnosis. And before we kind of ask questions and stuff, Mary, I'd like you to come in there and give your hand up.
Yeah, I just wanted to say that one of the messages we need to get across to the Irish community is about the success rates, because cancer is seen very much in the community as a terminal death sentence, when in fact the early diagnosis in particular, but the treatment is actually far more effective now than it was in the past. So I think that's one of the messages we need to get across, is the benefits of being treated and being diagnosed and treated early.
Thanks, Mary. That's a really interesting way to think about it, actually, coming at things more from that angle as well, because there is a lot of fear out there, and you see on the tube even nowadays 1 in 2 will be diagnosed with cancer. So it's very, I suppose, scary for a lot of people to even think about it, and sometimes we will block it out in our own minds. Even we don't want to think about it, but coming at it from that angle most certainly I think could be beneficial. So lots of takeaways today from everybody. Things mentioned there, you know, the emphasis of early intervention, prevention, getting that diagnosis, but really thinking about the barriers that maybe we can work on within our communities, within our organizations. How can we improve interaction education and engagement with services, thinking about what Mary said as well, in terms of coming at it from maybe slightly different angles. So I want to, first of all, before we take any questions or any comments, I just want to thank everybody for their time today. Really appreciate you all getting on. It was phenomenal to hear everybody's input and everybody coming from such different angles. It was brilliant, and really appreciate you, Diana, Marion, Clodagh, everyone getting on to join us as well. So thank you. Do we have any questions or comments or anything like that for the panel? Or anyone just want to come in with anything at the end? We're all good? Okay, so I'm going to stop the recording.